Recording.
All right. Welcome to the Love Rising, you guys. Today, Claire and I are super excited to welcome Karla, who I've personally worked with both chiropractic and with nutrition. And then we also all work together with doTERRA. So it's a really just kind of fun interview that we're going to be doing. Karla is really just a complete inspiration. She's actually lives pretty close to where I'm from and just is a really big impact and good force in our community. So feel very blessed to have her back. And here's her bio. I'll share a little bit with you guys. So she's not your typical chiropractor. When most people, I'm reading the wrong thing. Okay. I'm editing that out, but not on the video. So you guys get the pleasure of watching me completely screw up. Okay. So Dr. Karla enjoys helping and encouraging people find their true potential. She strives to be better than yesterday and inspires others to do the same. As a doctor and a coach, she appreciates teaching people how to overcome old injuries and move more efficiently in order to avoid future injuries. She pursued a major in biology and exercise physiology at Concordia in Moorhead and went on to graduate with honors from Palmer College of Chiropractic West and summa cum laude from Logan University with a master's degree in sports science and rehabilitation, St. Louis, Missouri. Since then, she has become a certified chiropractic sports physician, a certified strength and condition specialist, a level 1, 2, and kids CrossFit trainer, and a U.S. sports performance coach. She also works internationally with USA weightlifting and beach volleyball. She enjoys spending time with her new husband, Lucas, and adventuring around the globe. So welcome, Karla. We're so excited to have you. We always just like to kind of share your story with our listeners so that they can kind of get to know you and really resonate with just, kind of your approach.
Yeah, so do you want like where I grew up and not where I came from?
Whatever you want to share, kind of your journey through maybe how you really got into, because today we're really talking about using chiropractic kind of as a holistic healing approach, and that's really what we're all about. And so maybe your journey into that and how you've ended up where you are and that kind of journey.
All right. So I grew up in a very small town in Minnesota. And at first, I think I wanted to be a teacher. And then I realized that when kids don't listen, I don't want to be a teacher anymore. And was like, okay, well, I like helping people and was trying to venture if I should go into the medical field. I dabbled with, do I want to be a surgeon? And was trying to figure out what I wanted to do. So I was like shadowing primary care physicians, dentists, eye doctors, just the gamut. And I actually didn't even think about chiropractic right away. And I went home for spring break and I went back to my chiropractor who had helped me through a bunch of things in high school. And I was like, oh, well, he's got a pretty cool job and he works on the whole body and he's a pretty happy dude. So I started looking more into that and sort of where I ventured. I thought eyes were pretty cool and teeth were cool, but like it lasted a week and I wanted to work with the whole body. Nothing against eye doctors and dentists, but it wasn't for me. And then with the medical field, I just thought like, instead of writing a prescription, like there's so many more things that we can do to help you, especially in the chronic disease realm. And I wanted to be a force in that. So I went to chiropractic school out in Palmer West and San Jose, California. A, because I wanted to be in a warmer place, and B, just I wanted a different approach. And they had a big sports medicine approach to their entire program and loved it. And I actually took a residency at a VA in Central Texas for 7 months. So I got to work at a VA, and actually there I worked with people with a ton of chronic diseases. So I didn't do as much sports medicine there, but I learned how to work with a lot more of the chronic disease population. And then took another 3-month residency in Colorado, which was like all athletes, no chronic disease, for a little different realm. And after that, I finished up my master's in sports rehab. And I was really interested in the sports realm of how do I bridge like rehab to performance. There was a big disconnect. Athletes were just like, okay, you're done with PT, and now just go train with your team. And these injuries were just reoccurring and reoccurring. So my entire project was on bridging these athletes. And not only did I do that, at the University of Colorado, they fired a coach and gave me all of that person's teams. And so I got thrown into being a Division I strength coach real quick. And I learned a lot really fast. And I'm very grateful for that experience because I worked with a lot of sports that I had never done a lot of research about, namely like tennis and golf and skiing. And if you want to write programming for a track team, that's like 12 different programs in one. So it was a really good experience there. And that kind of led me to back to Minnesota, and then I ventured back to Colorado, back to Seattle, and finally settled back in Minnesota. And I think this is, for the foreseeable future, this is where we're at. So yeah, it's kind of my story.
Something that I love about Karla's approach is that, you know, she's very much about how can we keep you moving even during your injury. And I think for Matt and I mean, if you guys listen to our podcast, you know that we both do CrossFit or a hybrid of a few things. And so we're moving a lot, we're lifting weights. And so for us, we're pretty picky about finding a chiropractor that says, okay, you have an injury, but you don't want to keep moving. This is how we're going to work it. This is what we're going to do. You know, this is how I'm going to have you modify. Whereas so many chiropractors we find just say like, just stop moving completely. Just don't do anything, you know, avoid movement for X amount of time. Come and see me, you know, so many times. And so I really love that about Karla's approach. And so when we moved back to the area and we were looking around, that's kind of how we stumbled upon her. But also I just love that you truly work with anyone from chronic disease to athletes. So I think that anyone listening to this can really get a lot out of it. But maybe you could tell us a little bit more about what your chiropractic approach looks like when you're relating it to healing holistically, the whole body.
Yeah, so I'll kind of address the movement thing first. I find that a lot of doctors and the sports medicine world, it's like, oh, like I broke my finger and I need to stop doing everything because I have a broken finger. I'm just using this as an analogy because I literally just had it happen. So somebody comes in with a brace on their hand. Oh, I like broke my finger. I'm out of CrossFit for a month. And I'm like, okay, 95% of your body still works really, really well. And that 5% doesn't work so well. And I said, well, our coaches are really good and really well trained, and I've helped and worked with them. But like, okay, what can we get you to do to still move you towards your goals without, I don't want to damage this anymore, but how can we get you propelling that way? Like, can you run? Can you jump? Can you prop a bar and hold it with your thumb, like on your back rack? Like, there are so many things that you can do. Can I put a weighted vest on you? And can you still do that? Like, there's so many things that you can do. And the problem is if you have an athlete, like a high school athlete, and they have an injury and you take them out of their team setting, psychologically, it does a lot for them. There might be somebody that has like some lower back pain, and I'll say, okay, like I want you to go into your practice. You're going to do these drills. You're going to stay out of these ones for like a week or two, and then we'll get you back in. Because there's so many things that you can still do. And I think a lot of people, when you get injured, you're like, oh, I'm disabled. Well, maybe that part of your body is for the moment, but there's so much of you that's still very able. So why not work on getting that to be stronger? And then mentally, you're also going to be in a lot better place. So that's kind of my take on that. I, as an athlete, probably maybe push that button a little too much. And so I try and give people a good balance of like, these are our boundaries. Like, this is what we're doing. This is what we're not doing. As far as the chronic disease thing goes, I've gotten a lot more into functional medicine actually since moving back to Minnesota. I used to work with a naturopath in my office, and so she was awesome, and she did a lot of what I do now, which is take a real like look at people when they come in. I actually ask a lot about like, what are you eating? Like, how are you sleeping? When are your energy highs? When are your lows? And a lot of times, in all honesty, people eat just really, they think they're eating healthy, they're eating terribly. Like I just had something come in and they're like, oh, I had a banana for breakfast, and then I had yogurt and granola and strawberries for my snack, and then I had a salad with some veggies, and then they didn't have any protein till dinner. And I'm like, oh God. And they, in the realm of healthy food, like they're eating whole food for the most part, which is good, but like, let's balance some of these things out so your hormones are going to be a little bit more on keel. And also, I think some people come in with like, oh, my shoulder hurts, my hip hurts, my knee hurts, and both my ankles hurt. All right, well, first and foremost, you need to make sure that they don't have any orthopedic problems, because that is an issue and we need to address that. But a lot of times if you're having a lot of mechanical problems and multi-joint problems, it's a global inflammatory issue, not like you don't typically have 8 joints that are a problem at the same time. And then we get into, all right, like, what are you eating? And people hate having this conversation, but I make them super uncomfortable and I do it anyway. And, you know, there are very simple things you can do from a nutrition standpoint. And I go through into writing complete nutrition plans if people need like a complete life revamp, or if they have like certain goals they're trying to meet. But talking about those things, because I think food is like the biggest medicine we have available to us. I also work with Nutridyne and Metagenics products, which are a pharmaceutical grade product, and I will supplement with those, but I tell people, like, sometimes I have the patients who want like a supplement for this and this and this and this, and you know, my thing is like, you can't out supplement a poor diet. Like, you can't. It doesn't work. I'm like, you could come spend $300 here a month, but if you're going to continue to eat that way, you're literally like wasting, and like literally you're flushing this money down the toilet. So I really try and get people to think about food being more of a fuel source, not a leisure activity, which is what America's pretty much like. All meals have to be a leisure activity. I think one of the biggest ones with food for people here, not that food can't be a leisure activity, but it doesn't have to be a leisure activity 5 times a day.
Or a source of comfort. Like, I think leisure maybe is like a little off because we eat way too fast, and like I would love to see people be slower with their food, but they definitely, it's like we use it as a pacifier, as a coping mechanism, you know. Mm-hmm.
The emotional eaters, you'll definitely, you know, we talk about that, and there are other things, and I refer to a psychiatrist in town if we have a lot of those issues. But while we work through those issues, we talk about, like, if you are an emotional eater, all right, what kind of things are we going to make available to you that are at least healthy? So if you're going to emotionally eat like a bag of like sugar snap peas, carrots, and celery is better than M&Ms and cookies. So, you know, until we address the underlying like emotional need of why we need that food, let's at least put a healthy product in our hands until we can overcome that. So yeah, my practice has morphed quite a bit, and I'm happy where it's at. I get to do all sorts of things, and it's a challenge, and I like doing that.
I'm just curious, like, because I've been to a lot of different chiropractors, some amazing and some, you know, not as amazing. And I think there's probably like, you know, where you're at in your life and that kind of stuff too. It has to do with the patient. But like, why do you think, you know, there's a lot of chiropractors, and why do you think like more aren't kind of embracing this whole body approach, like the nutrition and the supplements? And, you know, I know you're constantly learning and learning more about digestion and all that stuff. So I'm just curious, like, why you think that is, that, you know, there's not, like, most chiropractors, would you say most chiropractors aren't talking about nutrition as much as they could? Or I don't know, maybe I don't know that.
You know, I will say, at least in my school, we definitely learned it in school. We learned a lot about it, but we didn't necessarily learn how to implement. And so it was like we were given all this information, but like, now what do I do with it?
Mhm.
And so I think a lot of chiropractors come out of school and it's like whatever was like for them very like they were able to implement, I think that carries over. I actually, literally I went through nutrition in college or in grad school and I was like, I'm never going to use that. Like, and when I worked in an office with a naturopath, not only I learned a lot from her, but I had that other person that definitely helped me out. I will say in my master's program, we had a sports nutrition class, which was like awesome. Like that made me critically think about so many things, and I really loved that. So I think a lot of it isn't necessarily like implementable like right away. I think some people have the ability to do it, and unfortunately it takes time. And it depends upon how your office is set up. And if you take insurance, you don't get paid. Chiropractors don't get paid to talk about nutrition. It's really unfortunate, at least not in this part of the country. And so I actually don't take insurance for that reason, because it takes my scope, which is like, I like to know a lot of things. It takes my toolbox and it literally shrinks it down. And one of the only things we get reimbursed for in my state is the adjustment. And if you're in my office for an hour, that takes 90 seconds. And in adjusting, like, I'm not taking anything away from that. And there is there is a place and a time and a need for that. But if I just adjust you and I don't educate you, for me, that's not fulfilling my oath as a doctor. In Latin, doctor means teacher. So I always want you to walk away with more knowledge on how to care for yourself or take care of your body, or exercises you should be doing, or things you should be staying away from, or this is how I'm going to hinge over to bend and brush my teeth when my back hurts. So my job is really to educate. Yeah, I treat you, but my goal is to get you to be able to self-treat and work through these things on your own, which is probably why my average, like for an episode of something, I think my average patient visit is like 2.7. So I don't see people very often for like an issue that they come in with, because hopefully I've given them enough tools to go out and work with that. Now, I will say I don't work with a lot of acute, like I prefer to refer out like acute lumbar discs. It's not my jam. I used to do it. I don't have all the equipment. And I will say, like, if I worked with those, like my average patient visit would be up a lot, because they need a lot of constant care and they need a lot of constant need. And that's just the way they are to get blood flow into that area. And I just choose not to work with stuff like that.
Yeah. And I think that's totally like how chiropractors get a bad rap, is that like, you just have to go and see them like, every week for an indefinite amount of time or something, and that's like, so I love that. I love that I love seeing this movement towards, and every healthcare practitioner is like, I want to work myself out of a job. I want to help people get to a place where they don't have to come in and see me all the time. And those are like the practitioners I feel like that, are good. That's like what our goal, right, is to help people help themselves ultimately. Yeah.
Actually, my first year of practice here, practicing like basically the exact way I wanted to, my accountant said to me, like, you make a lot more money if you saw people more, right? And I said, yeah, I guess my goal is to see them less so that they talk about it more, and then I get to see more people less times. And he was like, okay. So I thought, that was pretty like interesting point from my accountant.
So one thing that I find being kind of in this industry that I actually get very frustrated with is that people, and maybe you see this too, but so we're talking about holistic healing through chiropractic work, but we stumbled upon nutrition pretty early on into the podcast. So that's interesting, right? So people come to me, at least I notice, or not so much to me, but to different like things like chiropractic or this or that, where they come and they think, all right, this is just going to fix everything. I heard this is good to help my digestion, which I know it is, but then they're not doing the nutrition portion. They're not doing that. So how does this all fit together? And how important is it to, yes, maybe go and see a chiropractor so that you can do the preventative work, right? So that we don't end up with chronic illnesses or sicknesses or aches and pains. But how important is it to tie that all together to actually see the results? Can I just come to the chiropractor and think that eventually that'll just fix everything, but I don't have to work on anything else?
Some people might get lucky and just go to the chiropractor and they just fix everything. But I think if you want to be wholly healthy, you have to not, I think going is very important as a person. I go every other week, but working as doing professional athletic things like that for me helps me mechanically stay sound. I've had some pretty significant injuries in the past and that I like to keep under wraps. But I think if you want to truly be in health, you going to them is a great thing, but you also have to take some of that into your own hands. And I think we're so used to in this society, just going and you get a pill for this and a pill for that. And it's oh, it's so easy. I just swallow it. But actually taking that into your own hands and being all right, I'm going to do this. And, I've worked with a lot of patients and I've kind of worked with them on the chiropractic side, and I talk about nutrition, and I also know that I can't push people to you have to be ready to want to make the change. And I can't tell you to eat in a certain way or do a certain thing if you're not ready. I can plant the seed, and I do that, and it probably annoys a lot of my patients that we really need to be working with some of these things, you should be eating kind of X, Y, and Z. And so it's interesting. And at some point they tend to be okay, let's do that. I'm ready to do that nutrition thing now. So everybody has a place and time. So I plant seeds. I don't necessarily, unless you're 5 years from being 6 feet under. And I've had that conversation with some people, if we don't change now, you're going to be dead. I'm not even joking. And they're really? My doctor just said to take this medication. And I'm your doctor's lying. You're on a fast track to a grave. So I've had that conversation less than a handful of times, but otherwise I just try and get people to do it on their terms.
Is chiropractic work as powerful enough to help people get off of pharmaceuticals?
Yes, in some studies, with the whole opioid issue. I was actually just at a conference in San Diego, and there was a bunch of research presented. And chiropractic is for low back pain. Getting people off an opioid is actually your number one. Second is PT. I'm going to screw this up. Acupuncture's, I think acupuncture's third, and I think massage therapy is fourth. But chiropractic is leaps and bounds above the other fields to work on getting people off their opioid addiction from a lower back pain standpoint. So I actually know that research was presented, which I think is great. I think opioids for low back pain is not the place to go, nor is it for really anything. Your body has pain for a reason. And sometimes you need to address that pain, which is usually an underlying dysfunction. And if you don't fix the dysfunction, the pain will be there. I think a lot of people don't have enough body awareness to actually understand what dysfunction means. And that if you never have anybody watch your movement or you don't understand movement, there's a lot of dysfunctional people. So I definitely think it can get people off their pharmaceuticals. As far as doing if we're talking cholesterol, blood pressure, there is actually, I will say this, there are a few studies with upper cervical adjustments and blood pressure, and I don't know the exact numbers anymore, but there are actually a few upper cervical studies with blood pressure that have gotten people low enough to get off their meds. But as far as diabetes and cholesterol adjusting per se, the spine, there aren't any that I know of. So, there's some good stuff about.
Yeah.
But I think if we want to talk about getting people off meds for diabetes and cholesterol, if your chiropractor works with you on nutrition, yeah, there's a good chance you can get off that. But you have to be a little picky about your provider if they're going to talk to you about it.
One thing that really interests me a lot is like the nervous system, right? I went to I can't remember what it's called, but it's the chiropractic adjustments where they do the like very light touch. That it's yeah, I
It's
can't.
called Nemo.
Nemo?
Nemo. I think it's called Nemo. That's
That
one
doesn't.
anyway.
It doesn't sound familiar, but it was like they did like these very light touches, and they were like touching like nerve endings kind of, and really trying to get your body like, it was a more holistic approach in that it was trying to get your nervous system to relax. Because for me, I don't as much have injuries as I do just like these chronic places of tension, that just like seize up. It's like I'm carrying stress in my body kind of. And so it was like trying to deal with that from like a holistic approach, right? Like actually trying to stop that from happening, that pattern of just like tensing up. And so I'm just interested in like how, in a high level overview, like how the nervous system, when you have an adjustment, it's about the bones and the structure, but it's also about the nervous system and getting it back into rest and digest, correct? Like getting it back into that like parasympathetic state, right?
Yes. So what's really cool is when chiropractic, like in its infancy, we used to, oh, hold on here, I'll get a mop.
This video is so great because we can now show things like this. It's so much better.
Okay, so this is my spine, and let's say this is a disc issue. And so when we first originated, they thought, like the osteopaths thought that like if there was pain, that an artery was closed down. That was osteopathic medicine. Chiropractic, we thought like there was like a foot on the nerve, like a foot on the hose, and there wasn't any signal getting through. Well, we know that that's not false, but it was a good theory to get us thinking in a better way. So anytime there's certain types of touch, myofascial work, instrument-assisted things like grafting, gua sha, dry needling, acupuncture, whatever it might be, we stimulate the peripheral nervous system. And when we do that, those nerve endings that come from wherever we're touching, we used to think there was a lot more time spent in the spinal column and the spinal cord, but that information goes straight to your brain. And where the effect is actually making change is your brain. So now that the brain actually thinks about that part of your body to move differently than it used to. And so some of the newer stuff coming out about like fascial techniques, like say somebody comes in with tennis elbow and we're doing work here. So we think we used to just be realigning like a lot of the collagen fibers and this scar tissue, and we are doing some of that, but it's not as big of a change here as we thought, which is why when we start like getting people and we are doing whatever soft tissue technique we're doing through motion, the way that their brain thinks about that part of the body totally changes. And so your brain is it's plastic. It bends and it can mold and it can change. And so a lot of times we get people, a lot of the things we do is literally to get you to think differently about the way your body moves and the pain that you're feeling in your body. So it's a lot different than the old theory. And I think we've barely scratched the surface on what we've learned about how we affect changes in the brain. Chiropractic's a hard thing to study because it's a lot of subjective. But you can start putting some brain scans in with different things, and we know that we're having an effect in the brain, which I think is really pretty neat. And hopefully all these pain science people will like start to gather some really cool stuff. I'm not a great researcher, but I love hearing about the new things. And it's like sometimes these things we know they're working, and subjectively we know they're working, but the why behind why we thought they were working is changing a little bit. So it doesn't make them work any less or any more. It's just the why. I think is pretty cool.
So maybe I'm way off, but when we're talking about that effects on the brain, is there any research that shows that chiropractic work can also help with like mood enhancement or depression or anxiety or things like that as well?
I'm going to say yes. Off the top of my head, I don't have any like known like recent sites of it. But I'm sure if I look some up, I'm sure there are some. And I will say, with a lot of those, I don't know of any that are recent with more of like a brain image study. So a lot of those, you're going to find your subjective measures. But going back to that, there is actually, I do know of a lot of research done about aerobic activity that stimulates the inner cortex of the brain for depression, anxiety, addiction. And so exercise is like literally your best medication for that. And then for ADHD, exercise that is multi-positional, like gymnastics, karate, CrossFit, things that you have to move in all different shapes and ways for, that is the best for people with ADHD. And it can be just as good as medications. And if you want a great book, it's called Spark. It's called The Revolutionary New Exercises of Research in the Brain. And it goes through chapter by chapter, issue by issue, and kind of describes how exercise affects different portions of the brain. So there's a lot of good research out about that. But actually the adjustment, I maybe need to do some work.
Well, I think the thing that I'm trying to kind of get at here is that chiropractic can be such a good, and I think you even put it in the notes, entry point for so many things. And I mean, I even see that people who are into a very healthy lifestyle tend to fall back on the, well, like the doubt, or maybe then not having the knowledge of, oh, my kid suffers from ADHD, or I deal with a lot of anxiety, so I'm just going to go get a pill for that. And they don't realize that there's literally a holistic approach for everything that is treated for a pill. And I think chiropractic does really kind of work over a lot of those from as the entry point, kind of as you said.
Yeah. And I definitely think like, let's just say a child with ADHD. I know a gal in town that works a lot with kids and nutrition. After about the age of 10 is when I would start working with them. I don't really see any kids typically younger than that. But say you're working with ADHD, all right, like you've used Western medicine and you're on a medication. All right, well now let's address, all right, are they physically active like 45 or more minutes a day? And parents are gonna be like, no. All right, well, we need that to happen. And we typically want that to happen before their period of where they have to think the most. So we know when you're physically active, you actually secrete a hormone in your brain called BDNF, brain-derived neurotrophic factor. And with that, that's when you're the smartest. So go do something super hard, and then your moment of focus is like the best 40 up to 40 minutes after you work out. So if you can like work out really hard and do your homework, which is what we make all of our teenagers do at our CrossFit gym, and they absolutely hate us, but we make them do it anyway. We know that that's going to be your best time to focus. So first, let's get them moving. Then let's talk about the food they're eating. We need to get out those inflammatory foods. Typically, I'll just start with like an autoimmune paleo diet. And I actually recommend that the whole family follows it, because if Johnny can't have this and Susie and the other brother can have something, it doesn't go very well. Like this has got to be a whole family effort. Start taking out a lot of your glutens, your dairies, your soys, take out your all your processed foods, gone. And chances are like their ADHD is significantly better, and we can probably even get them on a lesser dose of that medication or even off of it. So I like to work with Western medicine to create a plan that's good for that person. And sometimes it means that we still might be on some medication, but we can control it a lot more through holistic things.
Yeah, I think that's a really important note, that, people are just like, so think that it has to be one side or the other, but really things can cohesively work together when it comes to holistic and Western medicine too.
Yeah, and I guess in another example, I will say I go to battle for my patients. I recently had a gentleman lose like 35 pounds. He was on blood pressure, cholesterol, and diabetic medication and had been for about 6 years. And he saw a dietitian in town, And she basically said, well, what do you want to eat for lunch? He's like, I don't think it's supposed to work that way. So he found his way here and worked with him and got his resting blood glucose levels or fasting blood glucose levels in the morning to go from 160 to like upper 80s, lower 90s. By the way, still on medication. Blood pressure was like 145 over 100, and we got that to 110 over 60. And cholesterol was at like 269, and we ended up at 187. So that's after 2.5 months of working with me. Now, he went back to his doctor, and I'm thinking, yeah, like we're going to decrease our meds, maybe get off some. And they told him, well, they're getting better because you're on medication. Mm-hmm. And I was not happy about that. So I asked my patient, I got a release of information, called the doctor, talked to the nurse, and they tried to pull that one on me. Well, it's because he's on medication. Like, would you like me to send over exactly what he's been eating and exactly what he's been doing for exercise, which is the reason why we see these pivotal changes. It didn't just happen because he's on medication. And I will refer him to a different doctor if you don't at least take a look at his pharmaceutical dosage again. I, as a chiropractor, can't put anybody on or off pharmaceuticals. They have to work with their doctor. But in this world, it's very difficult because they get reimbursed by those pharmaceutical companies to keep writing scripts, which is a completely just backwards way of doing things. So anyway, he's off 2 of the 3 medications. 1 dose got significantly decreased, and he continues to thrive and continues to do well. So it's challenging that I had to go to battle for him, but to me, it's worth it. So he did the work. He did all the things I asked, and let's get him off his meds.
I love that. Is that the one that CrossFit headquarters just came and did a story on?
Nope, that's a different one. I didn't have to go to battle. He worked with a really good doctor.
Oh, that's so great.
Yeah, we just had CrossFit here doing a story on one of our athletes who has dealt with a lot of mental illness in his life, mostly depression. Was even hospitalized to the point of having 30 electroshock treatments where they implanted a vein to try and shock him out of his depression. Mm-hmm. And not once, I mean, he's in his 40s, like not once did anybody ever tell him that like you should maybe eat well and exercise. So it was very frustrating for him to know that he was on 7 different kinds of medications a year ago, and now he's on one very low dose depression medication. So no, his doctors worked with him really well. They're like, wow, like your numbers are really good. We're going to decrease your dose, and kind of just kept us like in the loop with that. But yeah, his MD was great.
Oh, that's so cool. Well, I'm just hearing a lot about like just it's this beautiful cohesive plan of chiropractic, nutrition, and just movement. And we talk a lot about movement and just the enjoyment of it, right? Because that's what it's meant to be. That's what it's there for. So, so this has been really awesome just to hear, and you're so knowledgeable. So it's so fun. But Clara, do you have any other questions, or should we ask that our final question?
Let's ask the final question, because that's always exciting. I always get a lot of ideas from
Yeah, me too. So what is one thing that our listeners can start doing today, that they can implement really kind of today to help their bodies heal?
Ooh. I know you have probably people talk a lot about nutrition. So one thing I will tell you is do yourself a favor and do a little joint inventory. And this is from a technique called functional range conditioning. But like when you get up in the morning, move your joints. And if you have a lot of what we call, like, if I turn this way and you have, if I tilt my head to the right and you have pain on the right side of your neck, that's called closing angle pain. And if you're finding a lot of these pinch points in your body, that's probably a sign that you have a joint dysfunction. And if you continue to have those day after day, week after week, that's probably something that would be a good thing for you to address with a good. And I would say look up a sports chiropractor. They do a lot with joints, not only the spine, but shoulders, hips, knees, elbows, wrists, fingers, toes. They do a lot with that. And if you can work and find those pinch points and do your own inventory, you can catch a lot of things before they actually become painful. And so as a treating physician and being an athlete, if you can find dysfunction before it becomes pain, oh, your life is so much better.
I know. I'm like, okay,
Yep.
still pretty good.
Do some neck rolls, move that shoulder around.
I was doing this thing for a while where right when you wake up, you like roll all your joints out like 10 times kind of. So you're like in bed still, and you like bring your legs up and you roll your ankles, and then you roll your knees, and then you roll your hips, and then you roll your shoulders, your elbows, anyway, you go like through all your joints and even your eyes. And I don't know why I'm not doing it anymore. I need to keep, it was really nice. It was a nice way to wake up and you felt like, less stiff and looser, and
it's almost like a little meditation too.
Yeah.
And it's just like a self-assessment. And if you're finding things that keep repeating on that, that'd be a good time to go see somebody. So, because if things are repeating, eventually it's going to cause some pain.
What about like some cracks and stuff? Like, is that okay, or what's going on there?
That's a really good question. So people always ask.
We talked about this, so.
I hear this pop, you're grinding, or so that's called crepitus, and I didn't name it. I don't know why or they did, but basically it's called popping, clicking, joint pain. And it doesn't necessarily mean it's joint pain, and that's actually very normal in a lot of people. You can have tendons that kind of snap. You have, oxygen, carbon dioxide, and nitrogen that are in your joint capsules that kind of are like your hydraulic system. So sometimes they kind of crack and moan and whatever. And so it doesn't necessarily mean it's a bad thing. It can mean that you have if it's really bad, is that a good sound effect? It could mean that you have some degenerative joint issues that you might want to take care of and address. But when you do have degenerative joints, remember that actually the best thing that you can do is move them. When people are like, oh, I have osteoarthritis, and they stop moving, it's going to get way worse. So actually the more you can move your body, the better when you have degenerative joints. You just have to be a little strategic about how you do it. So yeah. The popping, clicking, grinding, that's called crepitus, doesn't have to be a bad thing. If it is combined with a lot of pain, then I would recommend seeing somebody about that.
And if it's in the same place all the time, no doubt you can always make one area, at my hip kind of will pop, or my groin, and it's I can do it anytime, but it doesn't hurt.
So if you can do it at any time, it's probably especially around the hip, it's probably a tendon snapping. It can be a hip flexor tendon. It can be on the side of your hip. But if it's always in a joint, so maybe some people roll their wrist.
Yeah.
It's always in a certain spot. If you hear the pop or the chiropractic pop, that's actually a release of carbon, and nitrogen and oxygen from that joint capsule. And what's interesting, the Canadians up north did this nice little study where you can only pop the same joint once about every 20 minutes. So I won't be able to pop that same knuckle for 20 minutes. They also found, these smart Canadians, because people are going to ask, is it bad that I crack my knuckles? All right. Yeah. So they did a 20-year study on knuckle poppers versus non-knuckle poppers. 20 years somehow managed to do this. And they found that there were no more degenerative joint issues in the knuckle poppers versus the non-knuckle poppers. It really had to do with your profession. So if you were a carpenter or you worked a lot with your hands, your joints were more degenerative than if you didn't. So it doesn't matter if you pop your knuckles. So if your grandma's your knuckles are going to get fat, actually they found that it's not true. You can pop your knuckles. You're going to be fine.
I do it every morning. I'm not constantly doing it, some people are kind of constantly doing it, but every morning when I wake up, it's all my fingers just pop, and it feels good, and it's okay. Mm-hmm. So I've always wondered that.
Yep.
So I'm happy to know that it's not a big deal.
From a chiropractic standpoint, as long there's some very important things in the top of your neck. So if you are like moving your neck and you feel those pops, that's fine. As long as you don't like take your head and physically try and move it. There's some very important arteries in the back of your head that you don't want to compromise. So let somebody that's been professionally taught how to do that one. Because I get a lot of these people that come in and I'm like, let's stop that one because you're putting your head into extension and that's actually not where you want to be.
Right. Awesome. Well, there is so much good information in here. I hope everybody now knows if they have crepitus. And I feel smarter already. Well, thank you so much, Karla. This was so fun. We might have to do like a second one. I feel like we could have kept going.
Sure. Thanks, ladies. Appreciate it.
Thank you.
Yeah. Have a good day.
You too.